Welcome. I'm excited you are joining me for a subject that is dear to my heart and that I love. I'm Jean Sheehan of Millennium Education. For over 20 years, I have been teaching medical intuition and giving medical intuitive consults. I've won awards and I'm internationally recognised. Medical intuition has also been taught at Queensland University. From the thousands of requests I have for sharing my knowledge of medical intuition, the most requested is hearing about the body and client stories. I agree, as this is how the brain learns, and we all love actual examples. So it's with great pleasure I give you these profound insights. You might want to grab a pen and paper so you can write notes. Know that as I share this wisdom, your innate will tap into the healing gift of medical intuition. I ask you to tune into your body and accept the love and healing that is offered. So take a big breath in now and breathe all the way out. Sit down and relax and enjoy this extraordinary work. There will be links you can click onto to contact me for courses, workshops. Or if you would like me to speak, please email info@absoluteempowerment or click the link. So let's see what the body says. Holistic healing. The word medicine means to make whole and complete. Plato, a mathematician and writer of philosophy, stated, "To heal is to make whole the entire mind, body, and spirit. To cure is to eliminate or relieve immediate distress." When I was nursing, I found the medical system wanted to cure but forgot to assist the process of making a patient whole. A heartfelt memory for me was nursing Mr. Banks. He was a diabetic patient who repeatedly was admitted for diabetic leg ulcer and weight reduction. Mr. Banks had been with us for many months. He seemed to be very happy and enjoyed his food. He knew the medical routines and each of the medical staff history as he took the time to get to know each of us. He practiced holistic care. He knew the routines of the hospital in and out. He knew what was expected of him with the weight reduction, but he chose not to play the game. One particular evening, I did not finish my shift until very late. All the patients mostly were asleep. Mr. Banks was due to go home the next morning. He had lost 22 kilograms and his leg ulcer was nearly healed. As I did my rounds with my torch to check on the patients, I noted Mr. Banks agitated. I found him digging at his wound with a fork and making it bleed. I switched on his light and sat on his bed to talk to him about what is happening and why was he hurting his wound. It was time for a holistic approach with no judgment from me. Mr. Banks shared he was more happy in the hospital as he got fed, he had company, he was given love, support and attention from the staff. My heart connected to his and I could feel his pain and isolation. He shared that he would create a wound so that he could get back into hospital and be cared for. Mr. Banks gifted all of us holistic care, and yet, as the medical system, we had not done that for him. That night, I sent notes to relevant staff to organise Mr. Banks' home trip. I reassured Mr. Banks that he would have a different situation when he got home. He had company and support. He was organised with Meals on Wheels He was organised with wound care to be done at home, someone to take him out for drives, someone to keep him company. The other important factor for me was to ensure Mr. Banks knew I did not judge him for this act. Now let's go back to the word medical. To make whole and complete. What if we allowed and provided situations and circumstances for people to feel whole and provide holistic care for people, animals, plants, and the earth? I know the world would be so different and that there would not be dis-ease. Remember, you are already perfect, just in different stages of remembering. Holistic healing is looking at the whole person. What's happening for them? Listen to them. See what they're sharing. See what their story is. For more information about medical intuition and how you can live the life that you love, click the links at the end of this presentation. Thank you so much for listening. It's been a real privilege to connect with you.